Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Also share the same professional edition CPT. So again, where the code 37220 in your CPT book is, make sure you put a sticky note there because we're going to be looking at that page quite a bit today. Excuse me. And then you also want to bookmark the page where it has 75650. That's in the radiology section. You know, once we get out of the heart, and now we're into the arteries and veins in the peripheral area, now we're looking at radiology services, which represent both the injection and the image for the study. So you want to look by 75650. It's also page 374 in your professional CPT book, and just kind of put a sticky note or bookmark that page there so that we can turn to that page if we need to quickly. Okay, so now we want to turn to our PowerPoint presentation, and I'm going to go by the different slides. First one says coronary versus non-coronary, so slide 2. When we talk about this, and I know this is an advanced course, so this part I'm going to probably run through pretty quickly. If you're taking an advanced peripheral course, it means that you're pretty versed in cardiology and that you should have a good working knowledge of how peripherals work. So we're going to kind of slide through this, make sure that you have kind of a reminder on how certain things work. I was recently in an office where I was told that the peripheral coders were 3 and 4 years of doing it, and I would say that they had probably a 50% error rate, which is a problem. So we want to make sure that we are understanding the rules, not just understanding the codes, and that's where I think peripheral cardiology has a little bit of a disconnect, where you can look at a diagram, you can look at codes on a diagram. Unfortunately, those codes, you also have to know the approach. Did you start in the common femoral artery? Was it a contralateral approach, meaning the opposite side? Did you start in the same side, ipsilateral approach, or antegrade, going down the leg, versus up and over? So you just have to understand some of the, not only definitions, but some of the rules when we try to code for these services. So slide 2 talks about coronary versus non-coronary. So rules for cardiac cath are different than non-coronary. So make sure you know that there's some limitations also when you combine the services. So what I'm talking about with a limitation. So let's say, for example, you did a heart cath, left heart cath, 93458. Plus you also did an injection, let's say abdominal aortogram, and you put the catheter at the level of the renals. Well, you can code for that image. If it's Medicare, it'd be a G code, G0275. If it's non-Medicare, it'd be a 70,000 code, 75625. But what about the catheter placement? Even though they're two separate exams, one's a heart cath and one is an abdominal aortogram, probably looking at the renal area, maybe looking at an aneurysm, you can't code for that non-selective or that aortic catheter placement, that 36200, in addition to a heart cath. The reason is because the rules for heart cath says includes introduction, so that's accessing the patient whether through the leg or the arm, positioning, putting that catheter up into the aorta and into the heart, and repositioning, pulling it out of the aorta, pulling it out of the heart, and then down through the aorta and back through the leg. So because that service itself includes all of that positioning of that catheter, you couldn't code an additional one. So it's rules like that that you're going to need to be aware of, so of why you can't combine certain services. So just be clear on some of those rules, and you'll be good to go and you won't overcode. Next, slide 3 talks about component coding. So each invasive or interventional procedure may be described by 2 different types of codes. Again, it depends what you're doing. If you're doing carotids, it won't be. It'll be one inclusive service. If you're doing lower extremity, it'll be a one inclusive service, unless you might have a diagnostic image, but again, we have to talk about that definition. But if you're looking at, let's say, renal stenting, you're going to have a code to do it. We call it a code to do it and a code to watch it. So you'll have a code to perform the service, an S&I code for it, and a catheter placement. When you get into the lower extremities, they've combined our services as of 2011. So we just have to understand the rules and the different procedures that may be described by more services. To clearly, completely, and appropriately define the portion or these studies, you might need to make sure you know about both of those sections. So the first section is radiology codes, and those are in the 70,000 section. So if you hear me use the word S&I or RS&I, that's a radiological supervision and interpretation code. That's actually what you did. You performed an angiogram.
SuperCoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.